Hi everyone, welcome to our podcast today with Dr. Pavitra Shankar. So before we begin, let me introduce you about Dr. Pavitra's profile. Dr. Pavitra Shankar is a psychiatrist with a special interest in women and children's mental health as well as community psychology. She completed her MBBS and MD in psychiatry from Lady Hardinge Medical College, New Delhi. Currently serves as a consultant for Akash Healthcare Super Speciality Hospital. She is also the founder of Vriddhi Centre for Mental Health. She has won multiple awards for her work in the field of psychiatry, and she has also been a TEDx speaker. So let us begin with the podcast with Dr. Pavitra Shankar today. Hi Dr. Pavitra, how are you?
Thank you so much. Thank you for that introduction. How are you?
I'm doing well. Thank you for asking. Thank you for also coming here today. So before we begin, I wanted to know how did you become a doctor and what was your inspiration to pick up psychiatry as a subject?
Right. So, interesting question. So I think I've always, for as far as I remember wanting to become a doctor and being drawn to the profession. And what motives, so much like everyone else, especially growing up in India, there is a specific image of doctors and the work that they do. So that was always there at the back of my mind. Probably there was no option B as well. So again, it was a very clear-cut path for me that I did want to become a doctor. But then I did not have in mind what specialty I wanted to go to. But interestingly enough, psychiatry was never one of the first choices in my mind. However, when I did get into MBBS, I realized that while it may not be true for all doctors, most branches do not go as deep and into so much conversation with their patients that psychiatrists do. And so in MBBS we have this internship of 1 year at the end of MBBS, where I had a psychiatry internship for 15 days. And I noticed that even the busiest of professionals were able to give at least 5 to 10 minutes minimum, even in a government setup, talking about people's problems and seeing how not just like their medical issues, but also their families, their societies, everything sorts of comes together, and that's how you see the patient. So that holistic care is probably the most in psychiatry. And I think because I also had a knack of talking with people and sort of figuring out things with them, therefore it felt like a great branch to sort of where my skills and my interests aligned.
Wow, that's really good to know. I feel psychiatry today is a very confused topic.
Yes.
Especially when we see on social media. We were also discussing about it before we came in for the podcast officially, that psychiatry today is very misunderstood. So what are your top 3 myths about psychiatry that you would like to break today in this podcast?
Right. So there are actually many, like you said, there are of course a lot of myths that are around psychiatry and mental health in general. One thing that I at least actively try to do daily before a patient walks into my office is that there is this conception that you go to a psychiatrist and you will be just given medicines and sent back home. But what at least I see a lot of people in my generation also starting to do this is actually have conversations with patients and try to understand and even explain to them what they're going through, because there is so much of misinformation, like for example, what is OCD, what is ADHD, and you may understand in your mind that this patient is going through this, but then if you're not able to make the patient understand what's actually happening, your job is not fully done. So the myth that psychiatrists only give medications and nothing else, or they don't really talk to you or listen to you, is something that at least I can see our generation and the next generations of psychiatrists sort of breaking. Second, which I have to do unfortunately almost daily with almost every patient, especially the ones who are just starting on psychiatric medications, is that they feel that these medicines will be addictive, or it's just something that they'll keep taking for the rest of their lives. But the reality is that we see something called as common mental illnesses and severe mental illnesses. So it's only in severe mental illness that you can see yourself being on treatment for like 7 to 8 years or sometimes even a lifetime. But in the most common mental illnesses, that is not the case. So we don't keep patients on treatment for lifelong. It is only an exception rather than the rule. And one more is that all psychiatric medications or all psychiatric interventions are supposed to make you sleep or change your mind or personality. But unfortunately, that is something which not all our drugs are capable of. There are only few specific things which work on sleep, and we don't have any medications which can change someone's personality. So that is also a myth that we're trying to, as a community of psychiatrists, we're trying to break almost every day in our OPDs.
Wow, that's really good to know. Especially, I agree on this that many people feel that if they start taking medications for any psychological issue, they would have to take it for the rest of their life.
Correct.
And they are also very worried about the side effects of those medications, and they feel that the society would shame them for taking medications which are related with psychological issues. That is true as well. So when we were discussing about new course launches that we can do for other doctors in the field of psychology, you suggested me about a fellowship in child and adolescent mental health.
Right.
So I want to understand one thing from you, that for a child, how important are schools in shaping their mental health? And how important are teachers and the entire ecosystem of a school for shaping a child's mental health? What role do they play?
Right. So, especially in child and adolescent mental health, we see that there are so in psychology, psychiatry, we even divide childhood and adolescence into many stages, because a child enters school at 4 or 5 years of age and goes on till 16 or 17 years of age, and there's a lot of development that's happening, not just in the thinking part or the cognitive part, not just academically, but also how they're emotionally growing up, socially growing up, what kind of language they're developing, what kind of self-image, how do they see the world, how do they see themselves. And a lot of it goes to happen in the school itself, because the child spends about a third of their, or a little lesser than a third of their time during 24-hour days at school. So if the school, the teachers, the admin, if they're not aware of what kind of problems may arise, if they're not able to understand which child may require more support from them, and if they're not able to pick up on signs of something going wrong with the child somewhere, and that is a major opportunity that can be missed, especially in child and adolescent mental health. And we also have policies for this. So we have the national education policy, which wants and which requires teachers to know about what is inclusive education. How do you incorporate people who are living with neurodiversity, autism, ADHD? If they are studying in the same schools as other children, how do you accommodate that? So if the teachers are not aware of that, it is a major setback, because then they might not be able to fully understand the reasons why a child may be behaving the way they do. And also it's a very major risk that signs may be missed, because sometimes symptoms or sometimes warning signs that they say, they can often only be present in certain settings. They might not be present at home. So of course, school plays a major role in all of the holistic development of the child, and and therefore that is why teachers need to be equipped with the right knowledge and the right techniques also to sort of elicit what is okay with the child, what is not okay, and what needs further attention.
That is very true, and I remember it takes me back to my school days where we had a counselor that was there, a psychiatrist that was there, and we were also instructed that if we have any issues, even peer pressure, even some issues from our friends or best friends, we can always go to the psychiatrist and we can talk to them. But then, what do you think? Are we overdiagnosing mental health in children today? Or we are just recognizing them finally? Like earlier we were unable to recognize those issues, and now we are able to recognize them.
Right. So again, with everything today, we have so much information about everything on the internet specifically. It's a double-edged sword. So yes, we now do know about what autism, we have heard about ADHD, we have heard about childhood depression, and these are terms which have started to become common in households also. So the parents are aware that something like this exists, and that such and such are possible symptoms of, let's say, these diseases. However, at the same time, and this makes it easier for us as psychiatrists or mental health professionals, because since that awareness part is done, patients can come to us and we can like screen them accordingly and tell them if something needs to be done. So there is, yes, a side where people are aware, and we don't see any evidence that their prevalence has increased. It's just that our awareness has increased. However, at the same time, because the information that is available online is not sufficient in itself, and sometimes it may also be false, there's also a lot of mislabeling that's happening. But that is majorly because people or patients may not go to the right professionals to get their diagnosis done. They may rely on online tools or self-assessments that may be present, and falsely diagnose that. So that is also a drawback of it. But overall, it's a good development that at least we're able to talk about these issues and people are aware, so they now know that this is something that needs to be going to needs seeing a psychiatrist or a psychologist. So prevalence has not increased, but yes, awareness has increased about it, which is overall a positive change.
So as you rightly mentioned about awareness, I think social media has also played a very important role. Right, and nowadays I keep seeing this post that if you are an adult and if you are insecure, it is because you had a terrible childhood. You know, I keep seeing these kind of posts that if you had a bad childhood, it affects you as an adult and it makes things a little difficult for you. So I just want to know that how much of this child's mental health is actually rooted in the parent.
Right. Okay. See, for every individual across all generations, no matter how much we talk about it now, we have data, we have theories, we have evidence that there are certain things like attachment styles, there are certain things like types of parenting, and they have certain effects on how a child grows on to see not just themselves but the people around them. And the type of parenting that happens, that definitely does affect how you are in your adult relationships also, because such patterns of how do you show love, how do you show care, and how safe do you feel in your family environments, that is something that the child picks up especially from the parents. That is definitely true. However, it's false to say that that is the only determinant of how a person would grow up to be, because oftentimes people make this false judgment that because this person had such childhood, that is why this person has grown up to be like this. I think that causal association you can't make. You can make, so in science we say something called correlation hai, but causation nahi hai. So correlation is that, fine, if someone has had a difficult parenting, there's a high chance that they may have mental health issues, but it's not that the bad parenting has caused mental health issues. So that cause-effect relationship is it's not very easy to ascertain that, because mental health is not just affected by your parents, it's also affected by your other environment, your own biology, your own psychology, the society that you're in. So it's fair to say that it has a role, but it's not the only thing that is going to make that effect.
I just have one more question. Like now when we were talking about parenting and if child mental health is also associated with bad parenting, does mental health issues also transfer from a father to a son? Is it also genetic? Just out of curiosity, I really want to know this.
Right. So definitely, we do find that not just mental illnesses, but also in psychiatry or just in mental health in general, what we do is we study behavior, right? So behavior can include things like impulsivity, decision making, or self-control, things like this. These are certain traits that we study. We do find that certain traits like this can be genetically going from one generation to the next. However, it is very complex to study or to determine that this is there in the father, so this will also be there in the child. But we do find that there is definitely a genetic composition of this as well. But the good thing is that it is something that we call epigenetics. That is, it is also determined by environment. So even if some bad gene, so to say, has come down to the next generation, given a good nurturing environment, things can go the right way as well.
That's good to know. Because I always thought that mental illnesses cannot be transferred genetically. I always felt so. But what you mentioned about behavior, I think that is quite convincing me right now that yes, behavior, and at least I feel that children especially, they start taking behavioral traits from their parents.
Correct.
That is one thing that I've observed. And many times, even in families, when we sit together, we often say that this child is more like maybe his father. He behaves a little more like his father, or maybe the child behaves a little more like his mother. So these are certain things that I have heard a lot from my relatives and my family when I was growing up, and they used to tell me that I walk like my father, I talk like my father, and I do things like him. So I completely agree that behavioral traits can definitely come from your parents, can come from the family, can come from your genetics. But then one thing that is concerning here, if I talk about child psychiatry, right, and there is a child who is having certain issues, maybe if we talk about autism or any similar issue, how comfortable are parents, allowing a doctor to prescribe medicines to a child? Because for therapies, I think they might be okay, and they might even be happy that okay, my child is going to a therapy. For example, for autism, we have speech therapies, right? For children who have different issues, there are multiple different therapies in the market. But how okay are they to allow a doctor to prescribe medicines for mental illnesses in children?
This is definitely a pain point for all psychiatrists, I guess, and especially those who are focusing more on child psychiatry as a core. The thing is that two things are there. One is that not all children diagnosed with a certain disorder will go on to be on medications. It's often the thing of severity that is the problem mild. If we take ADHD, for example, we might not prescribe a person living with mild ADHD a medication. But if it is moderate, severe, it is having some effect on academics and whatnot, then we may suggest that. However, often we do find resistance, and that is fair enough, because there is obviously a lot of skepticism about medications which affect the brain, right? So there is definitely some resistance which comes from the parents' side, and we always give them an option, and it is always therapies and medications go hand in hand. Even in severe cases, we want them to take therapies. We want them to have whatever else support they can provide to the child. But however, sometimes it is extremely necessary, sometimes that first medication helps a little bit, helps the child sort of come back to a little bit of functionality, so that the child is receptive enough to actually do what is being told in therapy. So it is sometimes extremely required. It is quite a back and forth conversation that we have with the parents. Sometimes they're convinced in the first go, and specifically sitting with them for a good amount of time, telling them pros and cons really helps. And sometimes it is something which is a repeated effort, where we keep telling them that okay, this is the benefit of starting medication now, this is the con of not starting medication, and what are your options right now. But definitely it's not easy for parents to accept that their child needs medications, partly because of the stigma that's involved, and partly because of course putting your child on a long-term medication for anything is something that every parent is bound to be skeptical about.
That is very true. Even as adults, we don't want to take medications for every problem. I have whole lot of friends who never take medications, even when they have fever or diarrhea or any such issues. They would prefer doing that ghar ka desi nuskha and all. They'll talk to their parents and get some desi recommendations from the house, but they would not actually go in directly for paracetamols and other tablets. So as a parent, I think for giving medications to a child, it is definitely a very difficult decision.
Correct.
Do you think doctors in India, especially who are dealing with children's mental health, do you think that the medical education system that we have in India, is it enough for them to be good at dealing children with mental illnesses?
That's an interesting question. Again, I think, so in medical education in India, we have one which is the undergraduation MBBS, and then we have the specialists. I would say in MBBS, again, it is a very varied structure across colleges. Even though the syllabus is the same, the training can often differ. However, I feel the focus is usually on symptom analysis, diagnosis, treatment, and we often miss out on treating the person. We are treating the illness, but often not treating the person, and therefore there is usually a lack of training in medical education in soft skills, counseling skills, interviewing skills, breaking bad news. So it's very funny that for breaking bad news we have a mnemonic which they ask us in exams, but if we were told to like break some bad news to a parent or a patient, we might not be very good at it. So that kind of training is often deficient, not just in child psychiatry or mental health, but in general soft skills which are definitely required by doctors that can often be deficient, especially in the undergraduate curriculum. And of course, when people go to post-graduation, it's only the few people who are working with children who might be have some training, and that would also not be very formal training. It would be a very experiential thing that they learn as they're seeing the patients. But I guess that is something that where we lack, because it's often not even tested. So even throughout your medical curriculum, you're never tested on your interviewing skills or how you're talking to the patient or how you're telling them something important. You're only tested based on your theoretical knowledge, and even in practicals you're not tested on these things. So definitely there is a lack of these skills in our medical education.
But this is what we spoke about. I mean, whatever we spoke about right now, this is for MBBS and MD doctors, right? What do you think about people who maybe do a BSc, MSc or a BA, MA in psychology?
Right.
I'm seeing that nowadays there are a lot of counselors, like counselors on social media, where I've seen that they have finished off their MA in psychology and then maybe they have done a certification course from somewhere, the credibility of which is a question mark for sure, because we don't know if other societies also accept it, if they have actually learned what they are claiming. So when they take this MA psychology or other similar courses, right? What do you think about these medical education system? Do you think they are enough?
Right. So this actually brings me back to a conversation I recently had with someone in my team, and we were talking about precisely this, that there is definitely a lack of skill-based training in rather all college courses, and even courses which require you. So after an MA in psychology, a lot of people will start as counselors and seeing patients directly, but there is no bridge that gaps the theoretical knowledge that they're getting from psychology books to actually seeing patients. So they might often not have that practice of seeing patients and doing the counseling skills. And this is true for almost all the college-based courses, after which you typically get a degree. So it's very true that a lot of people may get a degree which can maybe qualify them to be a counselor. Sometimes without a degree also they may be counseling people, but a structured program and where you're doing this practically under supervision and getting feedback, that is something that's very deficient, especially in the Indian system of in our country's system of sort of education, especially in the medical field. So it is deficient.
So I have one very interesting question for you, Dr. Pavitra. Would you actually recommend your juniors, people who have done their MBBS and they are planning for an MD, to take up MD in psychiatry? Or would you ask them to pick up some other mainstream subjects like diabetes or urology or cardiology? Would you actually guide them to take up an MD in psychiatry?
Right. So this is something that I have been asked multiple times, especially from my juniors. And one simple funda is that psychiatry is the only branch where you don't take it just because it's an option. You take it only if you're actually interested in it, because it is a little complex, of course, and it has its fair bit of challenges. And as you said, it is often not, even though it's a clinical branch, it's not a very popular or a very mainstream branch, because it's only now that there is awareness of mental health, and still there is a lot of stigma. So it's not something that I would recommend to anyone who's taking it without any interest in the branch. However, with the second doubt that people come with is that are there enough career opportunities? On that respect, I think and I genuinely feel that it is a field that is actually up and coming, and there are a number of opportunities in all fields, be it government or private, all sectors, and not just in healthcare but also incorporates in pharmacological industry and with all the research that is coming up. So it is definite as with regards to the job opportunities that are there, with regards to what you can do with the branch, there are immense possibilities, but the only caveat is that you have to take it only if you're interested in the branch, and because it's a long-term commitment that you're doing for possibly your lifetime that you'll practice psychiatry.
I've heard these statements from people that if you are a psychiatrist doctor, after many years into profession, you might lose your peace of mind.
Right.
So do you feel so?
Right.
Because I feel that, when you are a doctor who is dealing with a lot of people who are having mental issues, and not all of them are just issues. I think there must be many cases which are illnesses as well.
Correct.
Right? And you might be meeting the same set of people for multiple visits, for therapies or for treatments, and treatments that are quite longer. Generally, for other medical domains, the treatment is shorter, one surgery or maybe 1 month of follow-up or 3 months of follow-up. But here I believe you must be having a long cycle of the treatment that goes on. So is it correct to say that people who are a psychiatrist, they might lose their peace of mind after working in the field for 10 to 15 years?
Right. So one thing is that, and it is often something that we do talk about, especially in conferences where we have a lot of psychiatrists, because that is something that we all can relate to. It's a common pain point. See, life will anyways throw you lemons in some way or the other, right? So it's not that just because you have a profession which forces you to see people who've gone through some very unfortunate events in their life and have been living in very unfortunate conditions, that is not the only way where life can show you things which are difficult. Again, in medicine, the profession in general, for example, a surgeon will have to daily deal with life and death situations, and that can bring up another kind of mental toll altogether. But I understand why this question may come into people's minds, but I think it's quite the opposite. Because we see people having such complexities in their lives, and because we see people going through the difficulties that they are going through, and we see mental illnesses, it actually, and I genuinely feel this, it makes you more A, empathetic, and B, very open to the idea that things can improve, and it brings a very optimistic sort of outlook of things, because even in like the worst of conditions, I do find my fellow colleagues, even psychiatrists, even psychologists, being able to see what is the opportunity of change here. So for example, if in a condition, if in a situation, we see people every day where in my OPD, at least one day, daily I'll see a patient on whom the family member has given up, that there's something incredibly wrong with this person, and this is not my spouse that, for example, this is not my spouse that he was, let's say, 10 years back. Even there you're able to, and you have to, it's a part of your profession, that you make them understand why this is happening and how change can be done. So we actually see the sort of miraculous side of things, where things are able to improve even if it feels like nothing is going to improve. And often, as you said, that mental illnesses are chronic, so people have been living in despair for a long period of time, but you're able to see that ray of hope. So it's quite the opposite. In our community, I do find people who are people who are much elder to me, but they have such a good and optimistic point of view of life and a very problem solving attitude, and just trying to understand the why behind every human behavior, which sort of brings a very more than making them dull, I feel they become genuinely more enthusiastic and optimistic and happy in their own lives also.
I think this is very true, and I also feel that sometimes you will start feeling good, and you'll start feeling, yeah, you'll start feeling good that you are fine and people around you are fine, and that
True.
is such a blessing, because otherwise we have a very complaining nature.
True.
If things do not work my way, if I'm not finding a product that I like, or if I'm not finding something in my size, or there are so many issues. If my friend is not talking to me, I'll be so unhappy. But once you realize that how difficult life is for others, I think while treating them, you also heal a part of yourself which you never spoke about.
Very true, very true. We call this, that we often say that this profession is very humbling. It humbles you down because and it's not that we become saints. I mean, just here I also want to say that we also beg and are worried about the most smallest of things also. But for what it's worth, when it does get extremely difficult, you are able to see it in the other way also, because even if life in your personal life, even if you're going through something, but when you sit in that OPD and when you see people going through all that, you are able to see the big picture ki I do have some good things going on for me. So that does happen.
What you mentioned is actually correct. I also feel the same. It humbles you down, because I've never seen a rude psychiatrist. I have never seen a psychiatrist who talks rudely to people around or is unkind. I've never seen somebody like that. And most of them are so good. They'll say good morning, they'll talk to you, they'll definitely ask you how are you doing today. So I see these kind of changes in the personality of somebody when they take up psychiatry and they work in the field for a long period. Dr. Pavitra, when I approached you on LinkedIn and we were talking about launching a psychiatry course and having you as a faculty, and I believe we spoke for a long period of time trying to figure out what course do we want to launch at MediCOLL in the field of psychiatry. And later you came up with the option of child and adolescent mental health. So why that option? Why specifically child and adolescent mental health?
Right. I think specifically in medical curriculum, we all know the terms, we all know, okay, these are the disorders, these are certain behavioral problems, but it's so complex because here, the patient is the child who is often unable to tell you what's going on with them. And second, the person who's telling you is the parent, who's usually coming to you with complaints ki pad nahi raha hai bacha, or that the child has become very rude, or they have changed. That's the only history they'll give you. And then you'll have to dig out, okay, what is actually happening. And while on paper, all medical curriculums, psychology curriculums do teach that, but it's often the practical aspects of it that are sort of left out. And secondly, we now know that all mental health disorders, illnesses, conditions start in childhood. Even depression, we can see people being depressed since they were children. So if you're able to understand and point and sort of screen children for that, and if you have that knack of it, it not just helps you become a better professional, mental or medical health professional, it also helps the child being screened and diagnosed and treated at the very beginning stages of things. So it's a very important sort of component that needs to definitely be a part of medical curriculum as well, and also something that we are also trying to come up with this course.
That's very true. Have you seen programs like these in the market? And if yes, if there are certain programs on child and adolescent mental health, what are the gaps that you are seeing in those programs?
Right. So one is definitely there are some programs available on this. One gap majorly is that they're often very short term, and therefore because of the nature of that duration, it becomes a little superficial or rushed. And often there might not be opportunities of case-based learning, and sort of that interactive nature of classes might also not be present. And secondly, child and adolescent mental health specifically is something which requires a lot of in-depth understanding of not just what's abnormal but also what's normal. And along with that, one needs to be aware of what is the legality of it. You're working with children, you are supposed to know the legal aspects of things, you're supposed to know soft skills training, and some things which are often left out in a lot of these courses, which is definitely something we'll try to build up here in this course.
Right. So we have made the curriculum in a very structured way, right? And You have majorly made the curriculum, and you told me what has to be taught when,
Right.
and what are the case studies that should be discussed. So how important is case-based learning, like what we are aiming to provide at MediCOLL, for building real confidence in managing mental health problems?
Right. So, I guess it's important for all medical learning that it should be case-based, because I come back to the point that in psychiatry you have to treat the person, the family, and not just the diagnosis or treatment or the illness. So case-based learning helps you to see how actually complex, especially childhood presentations are. You can't just label someone as living with autism without seeing how the family is doing, without seeing what school they go to, without seeing what colony they live in, without seeing what their socioeconomic strata is. And that sort of insight only comes when you see or you hear or you discuss real life cases and systematically talk about how things are managed. So that's definitely a very important part of how you learn specifically child and adolescent mental health.
That is very true. For doctors who have completed MD in psychiatry, what are the other career options? For example, they don't want to work at a clinic, or maybe they don't want to start their own clinic. Do they have any other career options apart from, being in that patient-based job roles?
Right. So there definitely are more career options. One thing which is more correlated with the mental health and which is not directly patient-centric is we do have a lot of mental health centers coming up. Something that we're also trying to bring at our own center, that in Vriddhi, that even if the psychiatrist is not seeing patients, they're overseeing a team of mental health professionals. And we do have several examples of this where the same space can have multiple professionals, can have another psychiatrist, can have some occupational therapists, can have some psychologists. Like it could be a child developmental center, it could be a holistic mental health center. Or again, it could be research opportunities, because there's a lot of research that's going on. It could be in academic publication houses where you are the editor or the co-editor or you're the medical writer. Because specifically in psychiatry and mental health field, you do require some basic knowledge in order to be able to do that specific medical writing as well. Other than that, there are opportunities in so there are also opportunities with the people who work in nutraceuticals, and because there's a lot we find that a lot of probiotics, prebiotics, and there's a lot of connection between your gut and your brain. So psychiatrists do find roles there as well, and of course leadership roles in MNCs as well, because now we do find that even in HR positions, some of the people I know are working after their MD in psychiatry in such positions as well in multinational companies on a big scale. So those opportunities are there, and I guess that would be some of the ones that I'm aware of.
One thing that you mentioned in this particular discussion is very correct, the gut and the brain connection, because I have personally felt this, that whenever you are a little anxious,
Yes.
There was something go wrong with your stomach and that would really affect you. So I have felt this at multiple times. So yeah, I've read about this as well in some of the articles that was published in a paper. Whatever options you have given, all of them are really good career options for people who are considering a career in psychiatry. For a doctor who is watching us right now, who is watching the podcast right now, and he is maybe planning to enroll in the fellowship in child and adolescent mental health at MediCOLL, what kind of transformation clinically or professionally should they be expecting once they finish this fellowship program?
Right. So I guess what we are aiming to do is majorly, I guess, see, for doctors specifically, there are only so many medications that you can give in children. So medications is not something new that you may learn here, but what we're trying to give with this course is how the practical skills of how do you actually ask the child what's going on, how do you incorporate something that we call child and play therapy into your interviewing skills, how do you be ready if there is, let's say, so there are very unfortunate events that happen with children, how do you be ready to sort of address those, and how do you take, what is the importance of soft skills specifically in children who are living with neurodivergent conditions like autism, ADHD, and how do you educate parents, how do you realize how much the school affects, how much the whole, this is what we call biopsychosocial model of illnesses. That so having that holistic view of the biology, the psychology, the social aspects of specifically child and adolescent mental health. So biology is definitely going to be there, but the psychology and social aspects is what we're trying to give more with this course.
Right. Thank you so much for a wonderful insight about the field of psychiatry. We spoke about psychiatry, we spoke about different career options. We also spoke a little about your inspiration to take up psychiatry. And we also spoke about child and adolescent mental health. We spoke about what should schools be doing, what should parents be doing, and how parenting also affects, and how important genetics are when I talk about child psychology. So we have spoken about a lot of informative areas today in the podcast. So I believe it's a time to come to an end for this discussion. And before signing off, I would just like to ask one last line. What advice would you give to your 20-year-old self?
Right, so at 20 years, I think I was in MBBS and still figuring out what branch to take. The advice would be specifically that whatever you're doing, and in a strictly professional sense, try to find something which is at the intersection of your skills, your interests, along with opportunities present in the field. Anything that fits in that triangle is something that is worth going for. If not, at least have 2 of those 3 sets working for you if it is something that you're, for anything that you're trying to pursue in future, professionally at least.
Yeah. That's a wonderful advice, because if you are not happy at your work, if you're not happy doing what you want to do, I think it creates a lot of trouble in the future.
Definitely.
For 5-7 years, you might be okay, but after 8-10 years, you will just have this realization one day that maybe you lived life in a very wrong way and you could have done things better.
Right.
So that's it from our end. And thank you so much, Dr. Pavitra, for coming today.
Thank you.
I am very happy and blessed. Okay, cut it off. Yeah, so I'm very blessed to have you here, because I understand how difficult it is to take out time and to travel and come here for the podcast. I'm pretty sure this would be helpful for everybody who is watching. Thank you so much for watching.
Thank you so much.